Hey, good morning, guys. Casey, Hector.
Good morning.
Another beautiful day in Tampa. The weather just started to turn, so we're looking forward to a little bit of fall weather and playing a little golf. Perfect for golf. So, anyway, today, the reason why we're here is to talk about another subject that comes up on a daily basis. And I was talking to Hector about this beautiful woman we saw yesterday that is like a lot of people and has not been to the dentist since 1987, was it, Hector? Mm-hmm. And, you know, this is a woman with great intentions and leads a very good life and takes care of herself and wants a full life, but has this nagging issue that on a logical level makes no sense, but on an emotional level makes all the sense in the world, which is important to understand. And what I'm talking about, and the reason why she hasn't been to the dentist in that long, is because of the issue of dental phobia. And as a seasoned clinician, I can appreciate this debilitating condition because it stops so many people from living their best life. And let's face it, we all have obstacles that we know we need to do, but we need to get over the emotional hurdles to be able to get there. And that is difficult, and it requires professional help, and it requires an attitude of empathy towards it. And we have developed that in the practice because we look at each person as an individual. And as I said, each individual presents with different obstacles, and we're the resource to help you get to what you want. And until I understood the more difficult nuances to this issue, we were not that successful in helping dental phobics. So if we can dive into this just a little bit so that others out there with this fear, with this issue, may start to feel a little bit more confident that they can make it into the dentist and get that foot moving in the right direction. The first step is just making the appointment, right? If it's something you've been thinking about for so many years, but just can't get yourself to do it, and you finally pick up the phone or click the button to make the appointment, it's a huge step. But even more difficult is getting your feet to go through the door and sit down in the chair. That's very difficult, right? It's a natural response, and it's completely understandable given the situation, and it stems from past trauma. Oftentimes in this person's situation, it was a situation or a bad experience with wisdom tooth removal, unfortunately. And the scar tissue that develops is thick and it's permanent. Like a bad stain or like a bad scar. You don't get rid of it. You have to learn to live with it and to realize that it is something that's a scar, but it's not debilitating. And so if we talk a little bit more about how we deal with this, is we like to really completely understand somebody's story first. And we talk to dental phobics about, there's two levels on which we're talking, right? There's the emotional level, which is the most important. And then there's the logical level. So the logical level is, yes, we need to list the issues that have accumulated, and we need to find solutions to those. But the first step is connecting on the emotional level, that we are there to help and that we do understand their particular obstacles, and we do need to have a strategy on getting past the emotional barrier And so the emotional part is important because we have to develop a likeness and a trust. So the dental phobic or the patient has to look at myself and my staff as people who are trying to help them, not hurt them, and as somebody that they like and trust. Part of it is a gut feeling, and part of it is a reputation, certainly. But the other part of that is helping that person understand how we're actually going to do it. And when they show up for that appointment, when the work has to get done, they like to know what these steps are so that that fear of the unknown can start to unravel. And in this first appointment that we take, it is about hearing their story and about understanding how we can work together and understanding what those idiosyncrasies are, whether it's noise, whether it's the fear of getting numb, the injection, whether it's a particular, some cases something like the light can trigger those memories, right? We need to know these things. We need to know what is it that we can help you with, these triggers. And it's difficult because just in getting the information out, there's a lot of crying. And people feel shame, which is something that was difficult for me to understand because from my perspective, I am so happy that the person's sitting in the chair and tackling these barriers. And what I didn't understand is the patient is looking at me like embarrassed. They're ashamed as an adult that they haven't been in so long, and they think their condition is so bad, it's like an ugly monster. And from my perspective, I'm looking at it like, I'm so glad you're there because we can help you. We can help you out so much, and we're just so happy to do it because it's life-changing. It's something that matters so much, and to be able to help somebody with such an obstacle is why we're here. And we are built for that. And shame has to be addressed first. And it's the elephant in the room a lot of times. And just to not acknowledge it and say, you don't need to be ashamed, is not the right approach. So I understand the shame, and I understand that as an adult, you feel like it doesn't make any sense. Well, you haven't been to the dentist in 10, 15, 20 years or ever. But we address you where you are today. We start today. We cut the strings of the past and we move forward with wherever you are. Now, once we can connect and, if it's appropriate, collect the data that day, that is, let you into the sacred part of your body, which is your mouth, then we start to look at what the issues are, and so many times they're not nearly as bad as the person may think. And in this particular case, it was really not that bad at all. And the relief that comes of understanding that the unknown, once it's uncovered, is manageable from a logical standpoint, is huge. It's like, it's a huge sigh of relief. And that sigh of relief is healing, because now that clutter that may have been in your head is like, what is in that closet? And you figure out that that closet is manageable, and we're going to take everything out and clean it and organize it and put shelves up and get it looking good to where it's useful, is a huge part of the healing process. And now we can equip you with how we're actually going to do that. And the strategy for doing that is whatever it takes to address that anxiety. And oftentimes, it's understanding what's going to happen and feeling good about who's going to be doing the work, as we talked about. But sometimes it's pharmacological. Sometimes it is sedation. And we've talked about sedation in blogs numerous times. And the sedation that we do is conscious sedation. And it is oral. Take a pill, and we can refer you back to some of these blogs, so we won't go into it in depth. But it allows us to get past that hurdle, and it's a little bit of a hack, right? Because you are abdicating some of that responsibility because you're tackling it in an altered state. But you get it done, and you can do it safely, and you can do it without going totally out, right? Like with IV, we don't need to put you out with IV. We put you in a state where you're relaxed enough to get it done. And the goal is to make it sustainable. So how would you make it to the next appointment? And often there becomes a battle, which is, I don't think I need it the next appointment. My point is why battle it? If you don't need it and you're sure of that, fantastic. That's great. But if you think you may need it, that is completely fine too. Because I will tell you, some people will always need it, and that's completely okay, but there are others that need it 3 or 4 or 5 times, and then there's a point where it's like, you know what, I'm not going to use the trazodone this time. And it becomes more manageable because oftentimes in the beginning, it's a longer appointment. We got to play a lot of catch up. But there becomes at some point where it may not be practical if you need a simple filling or simple crown to use the conscious sedation for a procedure that may take an hour, correct? But if you do, we're fine with that too. So, that is one way that we manage it, and it is a very, very useful way to get somebody who's dental phobic and get the work done, and they become changed people. And what happens is that second appointment, it's like we're a team. They say hi to Hector, hi to Mark, part of the family, and it's like they're not excited to be there, but they're ready to roll up their sleeves and get to the next thing. And it's a different feeling, and it's a feeling of progress, and it's a feeling of growth. And that patient becomes very proud of themselves, and they should be. And we get emotional because we look at that person and see growth of somebody who was debilitated and paralyzed with fear, with somebody who now gets to the point where they are in the groove. They are back to getting their cleanings every 6 months. They are back to having a relationship with the dentist, and they are back to a healthy mouth and a healthy body, which is life-changing. And there's other little things that help, if it's the noise that gets to you, we recommend bringing your noise canceling headset and cranking up whatever you want to listen to. We don't suggest heavy metal, especially if you're going to be sedated. It made it so manageable, and now that's advanced so much more with a lot of the sound therapy that's out there, that you can turn on loud and get in a state to where you don't even hear the handpiece. And if that's what triggers you, that can help so much along with the sedation. And a cozy, heavy blanket. We have this bamboo blanket, which is like wrapping yourself in a cocoon. Patients love it, and it is so cozy, and oftentimes they use it and they want to go home and get one for the house as well. So we've got this blanket on you, we have the headset, you have a little triazolum, and you're in a safe spot knowing that you're surrounded with people that care about your situation and know and understand you. And it's really a welcoming environment that allows you to get that work done. And again, it is work, right? It's like anything worth having is you got to work for it. And the nice thing is that work, especially if you're using a triaslam, you don't actually remember that work. We talk to patients after they come back and say, how was it? They go, well, I think it was great. All I remember is getting here and you numbing me a little bit. And then the next thing I know is it's like we were done. And they go, how long did that take? And I said, that took about 4 hours. They go, it seemed like 30 minutes. It's like, great, that's a win-win. Because it really relaxes us, that's for sure, when we know that you're at the point where, you remember, you're not snoring, but you are just like, this is good, you know. How are things going? Going great. It's going fantastic. Let's keep doing it, you know. And yeah, we're happy to work 4.5, 5 hours. You know, you say, while the hood is up, let's get some work done. And the nice thing is yeah, you can knock it out and get 10 years worth of work done in one visit, and that's progress. So, you know, this gives you some insight into this condition, which we take very seriously and would love to help you with, and love to help you get past these obstacles that you can get on with your life and take that off your list. And guess what? You tackle that, you start tackling a lot of other things too that are in that closet. So thank you so much for the attention with this, and we hope we can help you.